Hi, I am Dr. Prosenjit Chakraborty, a senior neurologist from Kolkata, India. Today I'll talk about the do's and don'ts and some myths and facts about epilepsy. First of all, I'll tell you what is seizure and what is epilepsy because these things are not synonyms. Seizure is the clinical manifestation of abnormal, excessive, hypersynchronous discharges or excitation of group of neurons of cerebral cortex. And these discharges may produce subjective feeling or symptom or objective signs, that is clinical seizure. And when this is apparent only in EEG, this is called subclinical or electrographic seizure. Recurrent seizures without being provoked by any systemic or any acute neurological insult and probably with some underlying changes in the brain cause epilepsy. Now, incidence wise, seizure per year is about 80 per 1 lakh population, and lifetime incidence is about 9%, and among them 1/3 is febrile seizure. And for epilepsy, the lifetime incidence is about 3%, and per year about 45 per 1 lakh population suffer from epilepsy. So what I want to mean that the seizures and epilepsies are not at all uncommon. Now, before I go to the do's and don'ts, I think we should know the precipitants of seizures. The precipitants are the metabolic and electrolyte reasons or imbalance, sleep deprivation, then some drugs or stimulants can cause seizures like amphetamine, cocaine, sedative withdrawal, alcohol withdrawal, antiepileptic sudden reduction and withdrawal. These are also precipitants. Then stress and strain, sepsis, infection, fever, head injury. So these are the precipitants of seizure. So if we know the precipitants, then if we can avoid them, then we can reduce the chances of epilepsy too. Now I am going to directly the do's and don'ts of epilepsy. An epileptic should not light the fire in the fireplace in absence of somebody at home. If he wants to cook or if she wants to cook, then somebody should be present at home if possible. Walking with sharp objects like knife should be avoided. Regarding driving, this is a very burning issue that whether the epileptics should drive. If the epilepsy is very well controlled, then driving is allowed. In India, at least 1 year seizure-free period should be there to get the license. Regarding swimming, I feel personally swimming should be prohibited. Even taking bath in a bathtub should be prohibited because an accident can happen if the person has epilepsy seizures during taking bath in a bathtub. That can cause drowning. That can be a disastrous. Late night should be avoided. Long journey, especially a train journey, bus journey on the roads, should be avoided. Alcohol, I think that patients of epilepsy should not take alcohol. Then I'm sometimes asked that whether the TV, VCR, computer, mobile, these scientific things can cause any problem or harm to the epileptics. Yes, long-term use of computer or TV, watching for a long time can cause or initiate epilepsy or provoke epilepsy. So these are the don'ts. Now I'll talk about a condition when the person is having epilepsy, then what the people should do or not to do. Person is having epilepsy, so the people around him should be aware that what they exactly should do. So they need to have a training or knowledge about this. The most important thing is that when a person is having epilepsy, he should not fall and gets any injury. So, first thing is that lay down the patient on the floor. Do not carry the patient while having epilepsy to some other room, other area. Best thing is that lay down the patient on the floor in the left or right lateral position or side position, so that if there is any vomiting, that vomitus or vomit will not enter into the lungs and cannot cause any aspiration pneumonia or breathing problem. His head should be cushioned. The clothes should be loosened, especially the neck. If he wears a tie, that should be taken off. Clear off the area, the sharp objects that can hurt the patient. Be there until seizure stops. If seizure continues, try to check the pulse rate and see for the respiration rate. If it is abnormal, please contact nearby hospital. Take medical help. Now, when a patient has to be taken to the hospital while having epilepsy, not all cases should be taken to hospital, but if the epilepsy continues for more than 5 minutes, or the patient is pregnant lady, or he or she is a diabetic, or if there is any gross injury, patient should be immediately taken to a hospital. Now, what not to do when the patient is having epilepsy? Number one, do not try to restrain the patient's epilepsy. That can injure the patient. Second, do not put your finger into the mouth of the patient. Patient can bite your finger and cause injury. Do not put any sharp or hard object like spoon inside the mouth. Don't try to put water or do not try to feed the patient while having epilepsy. These are very important. Now, epilepsy is not common, but fact is that epilepsy is the second commonest neurological disorder in the world. Many people are suffering from epilepsy. In the beginning, I have told you the incidence rate. Epilepsy can be present at any age, any sex, anywhere in the world. So it's not at all uncommon. Yes, epilepsy sometimes is difficult to control, but more than 70% patients with epilepsy are very well controlled with anti-epileptic drugs. It is false that all seizures cannot involve level of consciousness, because if patient has focal seizure, then there is no involvement with the level of consciousness. Generalized seizures involve loss of consciousness or cause loss of consciousness. Foaming is not always present. Generally it is present with generalized tonic-clonic seizures or epilepsy. Now this is not right. More than 90% of mothers with epilepsy have very normal delivery. They have normal children. Nuisance idea is false. Yes, it is true. If the patient has generalized seizures, there is definite psychosocial impact. Focal seizures generally do not have any psychosocial impact that way. It's right. Most of the generalized tonic-clonic seizures or who are having chronic generalized seizures, these patients about in 60% cases are stigmatized and they are marginalized too. This is right. Yes, again it's almost same because the generalized tonic-clonic seizures or the chronic seizure patient, they have anxiety, depression and even suicidal rate about 3 to 4 times more than the normal general population. Well, it may be in the family, but not in all cases. Very rarely it is inherited, it is seen in the family. The other reasons are maybe head injury, cerebral tumor, stroke, dyselectrolytemia, inborn metabolic error. So there are many other reasons, apparent reasons for epilepsy. Not exactly, many patients of epilepsy, they are very much intelligent, but long-term epileptic patients with the anti-epileptic drugs, sometimes they feel a little bit with a low intelligence and cognition. But majority, they don't show any sign of lack of intelligence or low intelligence. Now, most of the patients of epilepsy, they are very good in sports where they can play any games, but maybe the chronic seizure patients, sometimes they feel very fatigued and they are scared of going to sports as a whole. I feel that epileptics can go for good. No, the restraining the persons while having seizure should not be done. That can injure the patient. No, there are many types of seizures, more than 40 types of seizures are seen. It is false because many patients of epileptics can die from epilepsy because of SUDEP or status epilepticus. SUDEP is sudden death in epilepsy and it is seen all over the world, and in most of the cases nothing can be done in those patients. So unfortunately the death rate is high in chronic epileptics. So if we summarize the whole thing, epilepsy is not uncommon, rather it is common. Epilepsy is seen all over the world, in any state, any country, in any age group, in males and females, in all races, in all religions. There are various types of epilepsy. I said that more than 40 types of epilepsy are there, and to know the exact classification and to have the exact treatment, the neurologist should see the patient. Epilepsy is never a psychiatric illness. Many chronic epileptics are stigmatized, marginalized. They feel barren to go to school, to go to sports. Marriage is a difficulty, to get a job is a difficulty in our society too. With the advent of newer anti-epileptics, epilepsy nowadays is better controlled, but to have a normal social life, what they need most is your love, care and support. Please help them. Thank you.